Stand up. Speak up. Get involved. Brought to you by the Maryland Association of Nursing Students. You may be wondering, why should I get involved? Does my opinion even matter? Many of the policies, bills, and laws passed dealing with healthcare affects us all in some way. Policies dealing with the 40-hour work week, affecting the livelihood of our nurses, safety needle devices for the safety of our healthcare workers, they all matter. Strength in numbers is exactly what we have. One person may not be heard, but together we can make things happen. We are constantly rated as the #1 trusted profession and have been for many years. So when we speak, they will listen.
Those in the seats of power around the table are who make change. If we in nursing are not in the role of policymakers and in the seats of power, then we will always be forced to stand behind the chairs. And if we refuse to become involved, then behind the chairs is exactly where we deserve to be. R. Mortimer. Nurses have a massive influence on social media. Take, for instance, Miss Colorado in the 2016 Miss America pageant. Miss Colorado, a registered nurse named Kelly Johnson, gave a monologue discussing her role as an RN. Some members of the media foolishly mocked her. What resulted was a social media storm from nurses and people who support nurses. Everyone used the hashtag #NursesUnite, and it ruffled so many feathers that the media outlet in question lost 2 major sponsors. If that's not a prime example of influence, I don't know what is.
In 1992, after following all of the protocols of her hospital, Miss Linda Arnold, a 22-year-old nurse at the time, just 4 months out of nursing school, was accidentally pricked with a needle that was infected with the HIV and hepatitis C virus from a patient that she cared for. 6 months later, she tested positive for HIV and hepatitis C infections. What's worse is that her hospital at the time were piloting the safety needle devices, but they weren't standard practice, at least not yet. This was very unfortunate and totally preventable. Linda, with the support of her colleagues and other organizations, sought to put an end to similar disastrous outcomes in the future. As a result, safety needles are now standard protocol. Now that's power.
So how can we all get involved? Well, for starters, you can join the National Student Nurses Association. The National Student Nurses Association, or NSNA, is an organization of over 60,000 nursing students. NSNA headquarters monitors federal legislation and policy making on issues of concern to nursing and healthcare, and notifies state presidents and legislative chairpersons when action is needed from constituents. Legislative information is communicated to state and school associations through imprint and the NSNA News. Getting involved with legislators is one of the best ways to make a difference. Identify the legislators that represent you at the state and national levels. Know their local office addresses and telephone numbers. For your federal legislators, you can get this information by going to the House and Senate websites written on this slide. You can also monitor your legislators' voting records through the internet. Contact their local offices. They can tell you their position on specific items. Contact them when you're in support of their decisions, as well as when you disagree.
Now, for some takeaways. Number 1, stand up and speak up for matters that must be addressed. If you don't stand for something, you stand for nothing. Number 2, you need to get involved because policy, bills, and laws affects us all. Number 3, we have strengths in numbers. Approximately 3.5 million nurses nationwide. Now that's amazing. Number 4, we are the #1 trusted profession for years running. Let's use that. If you talk, they will listen. Number 5, get out there and speak with your legislators. They can help make the necessary changes we long to see in the healthcare industry. United we stand, and divided we fall. So let's make it happen. All of our sources can be found here. Still have more questions? Feel free to contact us using the information below. We'd love to help. Thank you for listening.